In this episode, we speak with Executive Director of the National Care Forum, Vic Rayner, about the effect of COVID-19 on the social care sector. Hello, I'm Steve Iliff, and this is Altura Now. The world is getting used to the necessary restrictions intended to slow the spread of COVID-19. Some people are comparing the government and community response to that of wartime. And this is a war. On the front line are the doctors and nurses treating the infected. But there's another front, and that's those caring for our vulnerable. They're stepping up to do whatever they can in this crisis. But the social care sector needs support, immediate and ongoing support. With me to discuss this is Vic Rayner, Executive Director of the National Care Forum. Vic, thanks for joining us.
Thank you, Steve. Delighted to be here.
So, Vic, can you tell us what's happening in the social care sector in the context of COVID-19 and how critical is this time?
Well, as you say, we're all trying to get used to a very different and a world that none of us could have predicted even 2 months ago. So the social care sector is having to respond incredibly rapidly to this changing world. So there are lots of things that are happening immediately within the social care sector, lots of kind of preparations and ongoing changes that individual organisations are making. Now, where we start from is that COVID-19 is an infection. It's a viral infection that can pass, as we know, very quickly between individuals who are symptomatic. Now, in a care home environment, care homes are, of course, very used to managing infection control, so have some good understanding of how to cope with infectious diseases. However, the rate and the scale of this is very challenging for all care settings and care homes to cope with. So there are lots of things that organisations are doing, and I'm happy to talk all of those through.
And how well is the social care sector responding in the face of this crisis?
I think there's enormous resolve across the sector to provide the best care and support, but people are struggling on a day-to-day basis. I think it's, we've got lots of really big challenges that we'll talk through, I know. So huge challenges about accessing the right personal protective equipment, lots of concerns about the testing of people who are both coming into care services and being within care services and the workforce around that. Big issues on the horizon about how all of this is going to be paid for. We've heard a lot from the government about funding and putting the necessary funding in place for anything that needs to happen within the country around keeping this show on the road, and yet that funding hasn't yet come through to the care sector. So organisations already looking at kind of wage bills and facing concerns around that. So there are very different challenges for organisations on the front line.
So they're concerned about whether they'll be around next month?
I think that we are looking at making sure, what we need to make sure is that funding flows through quickly and effectively to those organisations. That's the last thing that they should be worrying about in this environment. But clearly all organisations within the social care sector are operating in an already challenging financial environment. We've had years of structural funding challenges, which are well reported by a whole host of different independent organisations, which mean that this sector is trying to cope with the COVID-19 pandemic under an awful lot of existing strain.
And there's a raft of measures that apply to social care for protection. I'm wondering if you could run us through those.
As I mentioned right at the beginning, obviously many organisations are used to a level of infection control, so it's not that they don't know how to use the equipment or that they haven't used the equipment previously, but they've never had to access it at the volume that they're having to do so now. And that's caused real problems in the supply chain and indeed the cost of those pieces of equipment. So you've got individual organisations busy trying to source masks, aprons, gloves, visors, all the things that they might need in order to be able to provide protection for those who are symptomatic or who are positively tested as COVID-19. I think on top of that, we've got very big issues around the guidance that comes out from government. We're busy looking at how to interpret the guidance to make sure that organisations are utilising the correct equipment at the correct time. But clearly alongside that, you've got a whole range of different messages coming out from people like the World Health Organization and others about recommendations about mask wearing and so forth. And of course, people who are receiving care and those who are working in that environment are not immune to picking up on those messages as well. So you've got kind of a real, PPE is one of the biggest problems for operational delivery on the front line. You mentioned about protection in the context of reducing the number of people coming into care homes and of course care at home environments. So there have been protections that individual organisations have put in place to reduce the number of visitors coming into services, and those have been very widely observed. You've also got that in the home care environment where people are. You've got carers going in, but others are reducing their take.
And we'll come to mental health in a minute. But just back on the supply chain, what is being done to ensure supply of PPE and other items?
So there have been lots of different efforts that have been put in place. So for social care, there are now some very specific suppliers who are protecting the supply for the social care sector. So there's a group of 7 suppliers who've been put together, and details of all of that information is available on our website and the Care Provider Alliance website and government information, etc. So that is intended to ease some of those situations. There's also been further supplies of PPE put out to local authorities via the Local Resilience Forum. So that again is another way of accessing that.
And there have been some changes to the Care Act, haven't there? Can you take us through some of the main changes that affect social care?
Of course, yes. So the Care Act was changed as part of the emergency legislation, and what that did, it was provide some what are termed easements to the Care Act. So that is, as you can imagine, is trying to make the Care Act more flexible and responsive to the emergency situation that we find ourselves in. So the kind of key things that I think providers might experience if those easements are put into place in their locality, and it is a locality by locality decision, is that they might see some changes in terms of how assessments are carried out by those local authorities. So they might find that the information that they receive in relation to those assessments is reduced. There's a shorter list of the information that authorities need to provide as part of that assessment. And they'll also discover that financial assessments that authorities were carrying out to determine whether people should pay for their own care or not will not be carried out under that easements process. So everybody will be paid for under the local authority system. So those are kind of 2 big changes that are going on. Alongside that, they will also be experiencing some significant changes around hospital discharge process. So people coming either from the hospital or from the local authority, they'll have reduced sets of information about what people's needs are, and they'll need to do more of that work themselves when people enter into their services.
Well, it's a difficult time for everybody at the moment. What are the mental health considerations we need to make as a community for staff working in social care and those receiving it?
I think for our staff, what we really need to be doing is recognising the fantastic contribution that they're making. So there are lots of things around kind of well-being that are increasingly available to staff, which might be in terms of kind of well-being support that's offered by individual organisations or by within the locality. There's lots of kind of apps and other things that are available for support, and increasingly some of those are being made available free to care sector staff. So it's definitely worth looking out for some of those. I think there is, we're getting to a situation where we have lots of really intense scenarios happening within care homes, where there may be lots of people who have are symptomatic or have been confirmed cases of COVID-19, and that will raise the anxiety levels of staff who, as I said before, are not immune to all the information that's out in the media around this, and will have been brought up to date about the potential impact of this virus on particularly on vulnerable people. We will very sadly see more deaths within care homes and home care environments, and cumulatively the pressure on staff is phenomenal. So we absolutely need to not only be looking after the well-being of our staff and the mental health of our staff now, but recognising that the impacts of this may stretch on for many months, if not years to come.
So resilience is key then, isn't it?
I think resilience is key, but resilience is one of those words that we often use, and we need to sort of put a bit of a framework around it. If we want people to be resilient, then we need to kind of build a structure for them to be resilient within. Care home managers are under extraordinary pressure in this environment as well. What else can we put in place to enable them to have an opportunity to talk to each other, to talk to counsellors, guidance, support, who may be able to help them through some of this scenario. I know that Skills for Care, for example, have a fantastic virtual managers network, so to encourage people to think about those accessing those sorts of resources at this time. I know that it's very difficult to sort of suggest that people go off and do something else when they're probably feeling that all they can do is battle, as you used a kind of war analogy, but actually, if they don't take some time out, then the implications for their service and delivery are even more significant. So we need to try and make sure we're building in some real focus on the mental health and well-being of all staff, and particularly thinking about the additional pressures and burdens on managers within this situation.
And this brings us to workforce issues. I mean, it's a big issue. We don't want to start losing people from the sector when we really need them most. What is being done that you've seen at the grassroots level to help maintain continuity of care?
Well, it's great, isn't it, that we live in a digital age, because clearly there are ways of connecting with staff, whether they're in work or whether they're self-isolating or others. Obviously, staff who are well and self-isolating, not those who are unwell. But so I think there are opportunities to kind of keep people engaged and up to date about what is happening. And I think from the point of view of people being anxious or fearful, perhaps, then the opportunities to really let them know what the situation is before they're coming into work, so that they're appraised of what's going in. I hear some great examples of that going on, and people staying very connected both in and out of the work time. I think there are lots of things that I know organisations are considering in terms of how they offer flexibility and support to the workforce. Clearly, the closure of schools has caused lots of challenges for individuals, and some people have been able to take up the key worker support element, and others have not been able to do that, but great employers have sought to flex their work patterns around individuals to try and ensure that they keep that continuity of provision within the workforce. So that's a very important part of the stuff that people can do. Clearly, pay is one of those, one of the things that organisations are thinking about, how they can alter or flex the pay to enable people to take forward additional shifts or additional cover within homes whilst others are self-isolating. So there are things that people are looking at, but for some organisations, the level of staff who've had to go off under self or family household isolation is very significant. We were looking at sort of 20+% of the workforce having to be off at any particular time, and in a sector that's already has a large vacancy rate, 122,000 at the last count. layering 25% of the staff being off through self-isolation or household isolation creates very, very significant problems on the ground. I'm not underestimating that in any shape or form.
Vic, can you perhaps talk about the importance of widespread testing in this situation?
Yeah, so I think there's two things that are important for social care in the context of testing. One is about the testing of people who are leaving hospital or coming into care settings from either hospital or the community. Now, clearly, the way in which you support and care for somebody is impacted by whether they have COVID-19 or they don't. So there are lots of guidance out there now about how to instill self-isolation, for example, within care homes and within home care settings. So so knowing whether somebody has been tested and whether they are COVID-19 positive is an important part of ensuring that they get the right care and support. So I think that's one side of it. I think the second side of it is about the workforce testing. And whilst we know that there are ambitions to test the health and care workforce, they're not happening quickly enough for social care organisations. I've mentioned that the huge numbers of staff who are off because of self-isolation or household isolation. If we could test those individuals and enable them to return to work, that would address one of the very significant challenges for organisations, which is around workforce and continuity of workforce, availability of workforce, and indeed reduce some of those additional costs that organisations are bearing.
And you've appealed to government, haven't you, to provide urgent and direct assistance to social care in the UK. But there's an ongoing crisis with funding that was there well before COVID-19. Has this crisis uncovered a fundamental weakness in the system? And what is the answer for reform?
I think you're right. I mean, as I said earlier, in a way, this crisis has come to a sector that has already experienced long-term underfunding in terms of its day-to-day provision. And yes, we have very clearly gone to government to say we need to make sure that the response, the social care sector response to COVID-19 is properly funded and covers the real operating costs of individual organisations. And I think we've been through some of those in our conversation, but those are about the very real costs associated with coping with the kind of staffing levels shortages that we've talked about, because clearly when staff are away, that doesn't mean you don't have to replace them with other staff coming along. So you've got double your staffing costs in where those vacancies are being instigated. There are very significant costs about the additional PPE that we've talked about, and not just the volume of it, but the pricing of it has gone through the roof, and so there's very real concerns about how that will be paid for. And there are other supply chain issues that are becoming of growing significance. In that sense, we are looking for some immediate action around that. We need to make sure that organisations are not thinking about how they're going to meet those costs, that they will be confident that those costs will be met without at speed and with the regularity that they need in order to keep the show on the road. So we're absolutely looking for government, both national and local, to respond to that very quickly.
Do you think that this is going to be one of the defining events of our generation?
I'd always hope for something more positive to be. I mean, in terms of how we respond. History will tell us, I guess. I think right now we are seeing some absolutely phenomenal response from care organisations. Whether we will have made some fundamental changes in our understanding of the role that care plays in our communities, I absolutely hope that's the case, and that's what we're fighting for, and that's what we're absolutely passionate must happen. We cannot end this terrible situation without having led people to really understand what a phenomenal job care staff do, and we certainly cannot end this situation with people feeling that it's okay then to revert to a situation where those who deliver care and support 24 hours a day, 7 days a week, do so at minimum wage. We must change some of these perceptions. This must be the legacy of this terrible infection and pandemic.
Absolutely. And what are some of the ways that NCF is involved in helping the nation through this COVID-19 crisis? You've got a lot of fantastic information on the website. And what are some of the other ways that you're engaged to help us through this?
Okay. Yeah, so I mean, we're doing a huge amount, and very grateful to all our membership and organisations across the country. We have members, lots and lots of member kind of calls, video calls, produce huge amounts of information, as you say, produce tools and ideas for things for people to use. And I think, you know, one of the very helpful things, of course, in all of these, in any challenge and situation, is being part of a community. And I think what NCF does for its members and you know, absolutely more broadly, is to create a community where people can share knowledge, experience and expertise, and can help identify solutions and ways forward. Because that, you know, whilst there's clearly, you know, much of what we do is about challenging and asking for different things to happen, but in order to do that we need to give some solutions as well. So we're very focused on the solutions for now, and as I say, beginning to really put together some thoughts about how we want this to, what we want the legacy of this to be for the social care sector. And we must make absolutely sure that social care gets recognised for everything that it has done during this and everything it will do going forward.
And so, just as a final note, what do you think is what would you consider the best advice for the social care sector as we work together to fight this threat and move towards recovery?
I think the biggest advice would be that whilst it's hard to put your head up and see what else is happening, it's vital that we do this. There's a huge amount of firefighting necessarily going on, but there is help out there. There is information. There are people like the NCF who will pick up and fight on your behalf. So really, I think if you can get a bit of space to put your head up and reach out, and we can use the information, we can use the evidence, we can fight on your behalf, and you know, between us then create a sort of more positive outcome for those that we're caring for, which is the most important part of all of this.
Vic Rayner, thanks very much for joining us.
Thank you, it's been great.
That's Vic Rayner from the National Care Forum. And remember, please keep up to date with government information and keep safe. I'm Steve Iliff. See you next time on Altura Now.